Hi, good evening. My name is Wes Shaw. I'm a physician assistant. I work in the orthopedic department at KSB. I work with Dr. Tommy Hernandez and Dr. Steve Gabriel. Tonight, we're going to talk about hip and knee arthritis, kind of just give you a general overview and some of the services that we provide here at KSB to help you with that knee and hip arthritis. So I usually kind of start with just describing what arthritis is. And there's lots of different types of arthritis out there, but the one that we mainly focus on is osteoarthritis here at KSB. Arthritis is a painful inflammation of the joints that can cause stiffness. Like I said, there's lots of different types of arthritis. There's osteo, which we're going to focus here. There's rheumatoid arthritis, which is more of an autoimmune disorder that's treated medically. There are some surgical things that go along with rheumatoid arthritis as well. But the initial treatment for that is trying to get a good grasp on that rheumatologic condition with medical standards. There's infectious reasons for arthritis or some other more obscure things like psoriatic arthritis or gouty inflammation. So when we talk about osteoarthritis, we're referring to degenerative changes within the joints of the long bones. So that typically is where the arthritis or the cartilage at the end of those long bones wears away. That wearing of the cartilage causes an inflammatory response within the joint, meaning that the body is trying to fix that damaged cartilage at the end of those long bones, but our body does not have the ability to recreate or make new cartilage. So as a result, it causes a lot of pain, stiffness. You'll get calcifications, we call bone spurs or osteophytes. And that can cause a lot of pain. So the more common places that we see osteoarthritis in our clinic is in the hips and the knees, and the thumbs are also a common spot. So I wanted to show you an x-ray here of what a normal knee x-ray looks like before any arthritic changes have started. And then that one on the right there is a picture of some severe degenerative changes. You can see that there's a lot of cartilage, that space between the bones, that's actually cartilage in that area, not truly air. And then you can see on the right where that space is gone, the bones are touching. That's arthritis that's developed. So kind of right there's a little bone spurs you can see as well. Those are called osteophytes. So that's just a sign of bone-on-bone articulation or severe degenerative changes in a knee. I also included a picture here of the hip. You can see on the left where there's normal joint spacing with the articular surface. And then on the right, it's near bone-on-bone arthritis and severe degenerative changes. And you can imagine why this would cause pain with those bony areas rubbing on one another. All right, so some of the treatment things that we can do here at KSB to help you with your arthritis. So one is we try to keep a good range of motion. So that's with physical therapy or even on your own, keeping that motion going. Two, we talk about activity modification. So not doing things that make it hurt, like deep knee bends or squats or physical activity. But, people have to live. They have to do their daily activities. You can't just avoid stairs because it hurts to walk up and down the stairs if you have stairs in your home. Maintaining a healthy weight, that's important. So they say that for every pound of weight that you lose, that can be up to 4 to 5 pounds of pressure across your knee joints. So that is imperative to try to keep a healthy weight when you have problems with knee arthritis. Over-the-counter medications. So Tylenol, ibuprofen, Aleve, those are some over-the-counter things that you can try initially. Glucosamine and chondroitin, some people swear by that to help with their knee joints. We do have some prescription anti-inflammatory medications that we use occasionally for arthritis pain, such as meloxicam is one of those. I personally don't like folks to use an anti-inflammatory for too long on a daily basis because there's complications that go along with that, such as kidney problems, stomach problems, gastritis, things along those lines. So we're cautious of that for daily use. Then we get into injections such as steroids or hyaluronic acid. So For steroid injections, we use intra-articular or into the joint, cortisone or steroid. We do that there in the office. For knees, we also inject other joints like shoulders, elbows, thumbs, but we don't do a lot of intra-articular hip injections in the office with the steroid. We do occasionally do some bursa injections for the hip, so that would take an approach to the outside portion of your hip rather than in the joint itself, but that's for a different problem. The steroids that we inject into the joints like the knees works well to decrease inflammation and helps decrease pain. The steroid shots sometimes will last for 6 months, a year or longer, but for a lot of folks that have end stage of arthritis, they're coming back into our clinic every 3 months or so to get an injection. We'll go every 3 to 4 months for steroid injections in the knee. There's another option out there called hyaluronic acid. So that is another shot that we give directly into the knee joint. That is not authorized for use in other joints for arthritis. According to FDA, it's an off-label use, and we only do knee injections with hyaluronic acid. So that shot, the idea behind it is it helps hydrate or lubricate the existing cartilage within the knee. So if you don't have a lot of arthritis, like in bone-on-bone articulation, then hyaluronic acid, in my experience, hasn't done a lot to help with that knee pain. But there are a small subset of folks that it works well for. So a lot of times that's one of those kind of last-ditch efforts that we'll try for patients before moving on to surgical intervention. So as far as surgery is concerned, there are the main treatment option or surgery for hip and knee arthritis that has failed non-operative management is a hip arthroplasty or a knee arthroplasty. So that means replacement of the knee or hip. So there are some folks out there that will get knee arthroscopies and kind of scopes essentially to clean up that cartilage. But that we have found and studies have shown is not the best treatment necessarily for severe arthritic changes in the knee. So we'll go to the definitive treatment, which is a knee replacement. So from the surgical standpoint of knee replacements or hip replacements, this is the definitive treatment for arthritis. So with the knee replacement surgery, we remove the portion of arthritis at the end of the femur and the tibia, here you see on the pictures, and replace them with metal and hard plastic components. On the hip part, we remove the femoral head or the ball portion of the femur that's arthritic, and replace that ball with a new one, as well as a little stem that goes down inside of the femur to stabilize that. And then for the cup component or the acetabulum portion of the hip, we put a new metal liner with a plastic lining inside of that to help with replace that damaged portion. So from a surgical standpoint, we have great infection rates. We have very minimal complications associated with these here at KSB. I've worked with, throughout my career, I've probably worked with 20, 25 different orthopedic surgeons in multiple locations throughout the Air Force and in the civilian world. And I could tell you that these two surgeons here, Dr. Hernandez and Dr. Gabriel, do a great job with their surgical technique and have probably the lowest complication rates that I've seen in my time. So I think that we do a pretty good quality surgical approach here. From a recovery standpoint, we typically have patients come into the hospital and are here for a day or so overnight. There are some places out there that will be send patients home the same day as surgery, but we've found that it's best from a pain management standpoint and to just monitor them overnight and let you go the next day. That also gives you an opportunity to work with physical therapy a couple, 3 times while you're here in the hospital. So we have patients, up and walking after their hip and knee surgery that afternoon and working with physical therapy. Our pain control is great. We use local anesthetics to help with pain and some intraoperative medications to help reduce that pain cost. And then, you're working with PT in the afternoon, and then again the next day, 1 or 2 times before discharge to make sure you're comfortable to be able to return home and start your rehabilitation process. We don't do a lot of inpatient or returning patients to a nursing facility or a rehab center any longer. Most of the time, patients are able to go home and do their physical therapy on their own. And we make sure that you have a good plan in place before the surgery to go home and have some help at home as well. Physical therapy is the mainstay of treatment after having a hip or knee replacement. You can have the best surgeon in the world do your surgery, but if you do not have a good team of physical therapists, to work with you and to push you to strive to do your best, then you're not going to have the best outcome. So the PT component, I feel, is very important, post-operatively for you as a patient as well, to be dedicated to make sure that you have the best outcome with your surgery. Again, we'd be happy to help you here at KSB for any of your hip or knee arthritis complaints. I think that, you don't necessarily have to go to the big city, to Rockford or to DeKalb or to, the Quad Cities in order to get good quality care for your hip and knee arthritis complaints. We can take care of you right here at KSB.